let me look at it this way. In our practice, for example, with obstructive sleep apnea, it's pretty simple in terms of metrics, because we have objective measures like with sleepiness scales, Berlin. You can do a before and after from that perspective. I think it's harder for insomnia. And how do you measure somebody's sleep quality? Let's see. Shall I put Dr. Sheikh on the spot? Do you focus on measuring sort of metrics for sleep before in your patients?
So that's a great question. We have metrics we have something called the MIDAS, which is a metric for migraine disability. And I do have patients sometimes keep apps for their sleep, and we can look at their sleep fragmentation and how many hours they got and how restless they were overnight. But I don't have any, like the MIDAS score is for migraine, and it gives you a number score. And so over time, you can see if their MIDAS score is getting better. I don't have anything specifically for sleep, although.
I think you bring up a really good point, though. And I think that nowadays with the wearables that people are having, I mean, they translate what the wearable is saying directly to their sleep quality. I mean, I have a lot of people that come in that are sleeping 7, 8 hours a day, feeling perfectly fine, but they come in and say, my watch says I don't get enough REM sleep, right? And I think it's important for us to say that, put that in perspective for them. And maybe a little bit of a change of topic, but I mean, are wearables something you see a lot for your patients coming in?
Yes. Patients are finding it themselves, and just in general, for migraine, wearables are exploding. For headaches and in neurology, wearables are exploding. There are apps and watches that you wear that can help to detect levels of stress using different biomarkers. Sleep, like we mentioned, patients will put in, their own triggers that they think they've had during the day, and then this will analyze all that information. Now, how much of it is validated, because it's so new, and we really don't know if all this information is kind of just static noise, or if it's actually interpreting it correctly and we're actually giving patients good information. That's all still very new, but it's exploding. Yeah. And patients like it because they feel like they're starting to get kind of control. There's things that because for migraine, what patients tell me all the time is, I want to know what's causing it. I want to know what's causing it. What's the underlying cause? And so it's really hard to sometimes give patients education about the fact that it's genetic. It's something that they have a predisposition to, and what they're interpreting as causes are really triggers for their migraine attacks. But the wearables are really exploding and really important. I think they're going to just keep growing going forward. Yeah.
Yeah, I think, I feel that in the realm of obstructive sleep apnea, we're lucky because you have so many things you can measure. If somebody's on CPAP, you have a whole array of, the AHI, the hours of use, the leak, all of that. So it's fairly simple to do objective measures of outcomes. Not so simple in some of the other disorders like insomnia and hypersomnia, where it's so much of it is subjective. Let's see. I'll ask Dr. Vanderbeek. And when you see your patients, and you obviously do a lot of surgery for hypoglossal nerve stimulation and other aspects, I think it's a little bit harder in those patients, right? Because how apart from doing repeated sleep studies, is there any other way you measure sleep quality in those patients?
Yeah, thank you for that question. We do have the habit to use some questionnaire, not only for clinical trials, but also in routine. So when patients arrive through our portal or before they come to the visits, they would fill out like FOSQ-10, Epworth, and at least we can look at those results and of course add some additional questions through the outpatient visit. But I noticed that throughout the years, there's a progressive attention that we put on that sleep quality measuring in the patients, also the patient that receive, for instance, like surgical treatment. Yes, indeed.
Right. I think, being in an academic center, you probably are much more rigorous in terms of follow-up for the patient because you also want those outcomes. And I think that it's something that's lacking certainly in a regular clinical practice like ours. So I appreciate that.
Yeah, I
And
agree. Thank you.
yeah. And Jonathan, if you're back, did you have any sort of comments on how you measure sleep quality in patients in your practice?
Believe it or not, we really usually don't employ any questionnaires. I actually have become very fond in the last year or so of a sleep profile, called the sleep profiler, which is a digression, but sleep profiler kind of tells me what's really going on with it. It sort of allows me to look under the hood, so to speak. So that's really what we've been relying on. And then the questionnaire from that, but I don't really have a standard sleep quality questionnaire that I use.
Yeah. Now, can you tell me a little bit more about the sleep profiler? Is that?
Yeah, it's Advanced Brain Monitoring is the company.
Oh, I see. Got it. Yep, I know about that. Sure. Interesting.